Thank you.
The Senate's in a quorum call, Senator,
I would ask that the quorum call be vitiated.
without objection.
Madam President, I understand that there is a lot that's going on in the world today. We are worried about climate change and what that is doing to our planet. We're worried about the terrible war in Ukraine and all of the destruction taking place there. We're worried about inflation and the fact that wages are not keeping up with the prices that people are paying. We're worried about the massive level of income and wealth inequality that exists in our country and the increased concentration of ownership that we see in the United States, among many, many other things that are on people's minds. But to my mind, Madam President, the American people remain, and always are, deeply concerned about an issue that by definition touches each and every one of us, and that is our collapsing and dysfunctional healthcare system. While it is not discussed much in the corporate media or here in the halls of Congress, we have today in the United States the most inefficient, bureaucratic, and expensive healthcare system in the world. And that's not just what I believe. That is what the American people know to be true because of their lived experience with the healthcare system. Madam President, I would hope that all members of Congress take a hard look at a poll that was published yesterday by the Associated Press Nork Center for Public Affairs Research. And this is some of what the poll disclosed. At a time when I hear many of my colleagues tell us that we have the best healthcare system in the world, it turns out that according to this poll, just 12% of the American people believe that healthcare in general is handled very well or extremely well in the United States. 12%. At a time when we pay the highest prices in the world for prescription drugs, only 6% of the American people believe that prescription drug costs in the United States are being handled well or extremely well. 6%. At a time when COVID has exacerbated the crisis, only 5% of the American people believe that the mental health care system in the United States is being handled well or extremely well. 5%. And when so many older Americans have died unnecessarily in nursing homes, and when so many cannot even find the nursing home bed that they need, just 6% of Americans believe that the quality of care at nursing homes in the United States is very good or exceptional. 6%. Madam President, the American people increasingly understand, as I do, that health care is a human right, not a privilege, and that we must end the international embarrassment of the United States of America being the only major country on earth that does not guarantee health care to all of its citizens. And again, that is not just Bernie Sanders talking. That is what the overwhelming majority of the American people believe. According to yesterday's AP poll, 66% of the American people believe it is the federal government's responsibility to make sure that all Americans have health insurance coverage. 66%. Over 86% of the American people believe that it is absurd that millions of senior citizens lack dental care, hearing aids, and vision care, and they believe that Medicare should be expanded to cover these basic health care needs. happens to be an issue I've been working on for several years. 86% of the American people believe that Medicare should cover dental care, hearing aids, and vision care. 86%. Madam President, at a time when our long-term health care system is in shambles, 81% of the American people believe that Medicare should cover the outrageous cost of long-term health care for senior citizens and people with disabilities. 81%. And Madam President, I ask unanimous consent that this AP poll be placed in the record.
Without objection.
Thank you. Madam President, it is hard for me to imagine how anyone could defend a health care system in which over 70 million people today are either uninsured or underinsured, insurance at all. Madam President, we are talking about, and I know we don't talk about it much, but maybe we should, we're talking about some 68,000 Americans who die every single year because they are uninsured or underinsured and don't get the medical care that they need. This is the United States, the wealthiest country in the history of the world. 68,000 Americans should not die every year unnecessarily. Madam President, I am tired of seeing working-class families and small businesses pay far more for health care than they can afford, which results with more than 500,000 Americans every year declaring bankruptcy because of medically related expenses. 500,000 Americans declare bankruptcy because of outrageous health care bills they simply cannot afford to pay. Families in America should not be driven into financial ruin because someone in that family became seriously ill. Sickness should not be a cause of financial ruin. Madam President, I am tired of hearing from Americans who lost loved ones because they could not afford the unbelievably high cost of prescription drugs. And I'm tired of hearing from constituents who are forced to cut their pills in half due to the cost. Today, unbelievably, almost 1 out of 4 patients cannot afford the prescription drugs that doctors prescribe. And when you want to talk about an irrational and dysfunctional health care system, think about a system in which people go to a doctor, they get diagnosed as to their health care problem, they get a prescription drug prescribed to them, but they can't afford to buy the drug the doctor prescribes. So what ends up happening? They end up getting sicker. Maybe they end up in the emergency room at an outrageous cost. Maybe because they couldn't afford the prescription drugs in the first place, they end up in a hospital at a very high cost. Maybe they die. That is an irrational and absurd health care system. Madam President, I am tired of talking to people and families of people who are struggling with mental illness but cannot afford the mental health counseling they desperately need. Last year, as you know, a record-breaking 100,000 Americans died of drug overdoses. And I will tell you that in my office, and I'm sure that in every other Senate office, we get desperate calls from family members looking for affordable mental health counseling. And far too often, that care simply is not there in the community. People are struggling with husbands, wives, kids who are on the verge of doing something terrible to themselves, to others. And yet in this country, Despite spending far more for health care than any other country, we don't have the capability of helping those people. Madam President, it's not there. The mental health counseling, the help that people need, is not there because in this system, geared toward the profits of the insurance companies rather than the needs of the American people, we don't have enough psychologists, counselors, or social workers. Unbelievably, despite spending far more per capita on health care than any other nation, we don't even have enough doctors. We're facing a major doctor shortage in America now, which will only get worse in years to come if we don't address it. We don't have enough nurses. We don't have enough dentists. We don't have enough medical providers in general. We have, however, more than enough people who bill us and more than enough debt collectors who hound us to pay for a bill we cannot afford, but we just don't have enough people to provide the health care that we desperately need. And by the way, that crisis of lack of health care providers is only going to get worse as our society continues to age. Madam President, at a time of declining life expectancy, in the wealthiest country on earth, your health and your longevity should not be dependent on the amount of money you have. It is an absolute outrage and grossly un-American that the number of years we live in this country is dependent upon our income. Studies have shown that the top 1% of Americans live 15 years longer than the poorest people in our society. It's not only the very top as opposed to the very bottom. It's wealthy people in general versus working class people. If you got the money, you're going to live longer in this country than if you do not have the money. In my view, health care is a human right that all Americans, regardless of income, are entitled to. And all Americans deserve the best quality health care that our country can provide. Further, as chairman of the Senate Budget Committee, it is not acceptable to me that we end up spending over twice as much as virtually any other major country on earth per capita. Twice as much per capita, while our life expectancy and other health care outcomes lag behind most other countries. And this is really quite an amazing thing. We spend more, and yet our results are worse than other countries. Unbelievably, according to the Center for Medicare and Medicaid Services, we are now spending $12,535 per capita on health care. Imagine that. Over $12,000 for every man, woman, and child in this country. This is, frankly, an outrage. France spends $5,400, Canada $5,900, Germany $7,300. We spend over $12,000 per year. The question that everyone should be asking is, how does it happen that we spend so much money for health care, but we get so little in return? And Madam President, let's be clear. The current debate over health care in the United States really has nothing to do with health care. Frankly, it is hard to defend this. But in 2020, the CEOs of 178 major healthcare companies collectively made $3.2 billion in total compensation, up 31% from the previous year, all in the midst of the pandemic. People dying every single day, cost of health care soaring, and yet the CEOs saw a 31% increase in their compensation. Madam President, according to Axios, in 2020, the CEO of Cigna, David Cordani, took home $79 million in compensation. The CEO of Centene, Mr. Needorf, made $59 million. The CEO of United Health Group, Mr. Wickman, received $42 million in total compensation. But it is not just the health insurance companies that are ripping off the American people, it's the drug companies as well. In terms of the pharmaceutical industry, last year, Pfizer, Johnson & Johnson, and AbbVie, three giant pharmaceutical companies, increased their profits by over 90% to $54 billion. How's that? In the midst of a pandemic where we have lost now over 1 million people, where millions and millions of people have become sick, the profits of the major drug companies went up by over 90%. The CEO of Moderna got a $926 million golden parachute after his company received $2.5 billion in taxpayer dollars to develop the vaccine. We all appreciate the development of the vaccine, which is saving lives every day. But really, does the CEO of the company that received $2.5 billion of taxpayer money deserve a $926 million golden parachute? That is an indication, a manifestation of a sick and broken healthcare system. And while over 330,000 Americans died during the pandemic because they could not afford to go to a doctor on time, the CEO of Regeneron Pharmaceuticals made over $450 million in total compensation. Madam President, the current system is failing the American people, and the American people want change, real change. In March, months ago, I was pleased to introduce Medicare for All legislation with 15 Senate co-sponsors. Companion legislation in the House now has 122 co-sponsors. This legislation would improve and expand Medicare to cover over a 4-year period health care to every man, woman, and child in this country. In other words, what this legislation finally does is make sure that the United States joins every other major country and that we guarantee health care to all of our people. This legislation is comprehensive, and it would end out-of-pocket expenses, and unlike the current system, it would provide full freedom of choice regarding health care providers. In other words, on the Medicare for All, there would no longer be insurance premiums, deductibles, or co-payments. No more networks which deny you your choice of doctors. And when I talk about Medicare for All being comprehensive, it would cover dental care, vision, hearing aids, prescription drugs, and home and community-based care. In other words, Madam President, it would do precisely what the American people want us to do. Would a Medicare for All system be expensive? Yes. But while providing comprehensive care for all, it would be significantly less expensive than our current dysfunctional system because it would eliminate an enormous amount of the bureaucracy, profiteering, administrative costs, and misplaced priorities inherent in our current for-profit system. Remember, we currently pay twice as much for health care as do the people of virtually any other country. And all of those countries manage to provide universal health care. So yes, we can provide quality care for all at a much, much lower cost per person. On the Medicare for All, there would no longer be armies of people billing us, telling us what is covered and what is not covered, and hounding us to pay our hospital bills. What they certainly won't tell you is that Medicare for All will save the average American family thousands of dollars a year. In fact, a study by RAND found that moving to a Medicare for All system would save a family with an income of less than $185,000 about $3,000 a year on average. Now, one might ask, fair enough, if Medicare for All is so good, if it has so many advantages, if it's what the American people want, why hasn't it been enacted by now? Why hasn't the United States joined every other major country in guaranteeing health care for all? And that, Madam President, takes us to our corrupt political system and the outrageous way we fund campaigns. So I would suggest, if you want to know why we are stuck with a dysfunctional healthcare system that fails the American people, but makes the drug companies and the insurance companies wildly profitable, follow the money. Follow the money. Since 1998, in our corrupt political system, the private healthcare sector has spent more than $10 billion on lobbying. Got that? $10 billion on lobbying since 1998. And over the last 30 years, it has spent more than $1.7 billion on campaign contributions to maintain the status quo. And in terms of their lobbying efforts, let's be clear, they are very, very bipartisan. There are former Democratic Party leaders, former Republican Party leaders working together to represent the insurance companies and the drug companies. And by the way, of course, in terms of the campaign contributions, Madam President, the insurance companies and the drug companies are also very bipartisan. In fact, their contributions go to many members of both the Democratic and Republican parties. It doesn't really matter if you're a Democrat or a Republican. What matters is you protect the interests of the drug companies and the insurance companies. But you know, Madam President, what I believe is that maybe
Madam President.
The senator from Nebraska.
Thank you, Madam President.